Hey Jake, I'm Alex. I'll be your student physical therapist assistant today. So today we're here to talk about emphysema. Okay?
Okay.
So emphysema is a type of COPD that causes shortness of breath. What happens in patients with emphysema is that the air sacs or alveoli in the lungs become damaged. And due to this, they start to weaken and eventually they might rupture. When they rupture, this creates kind of a dead space, or there's the alveoli becoming large. And with the dead space, if that is increased in the lungs, decreases the surface area of the lungs. So if you have decreased surface area, decreased gas exchange in the lungs, so decreased oxygen getting to the rest of your body.
Gosh.
Not what we want.
No.
Okay. And since the alveoli are damaged, right, air, they don't work properly because they're damaged. So air becomes trapped in them, so it's harder to get the air out. Okay, so exhalation might be a little bit more difficult.
Oh yeah, it's tough.
One thing you should probably know is this treatment might manage or help you cope with emphysema, but the damage is already done. It's not reversible. Sorry to say, but it's okay. We will get better.
Okay.
Also, one thing you should know about emphysema, there's a generalized term called pink puffers.
Okay.
That's what people call people with emphysema.
Yep.
All that is just kind of describes the person. It's supposed to be a person that is relatively thin, has like a reddish tint to their face.
Oh, okay.
Has shortness of breath, and they might have a barrel chest too. They turn red because since they have a hard time getting the air out, air gets trapped in the lungs, so it takes more breaths, or you breathe more rapidly
okay. Gotcha.
breathe.
Yeah.
Okay, so some causes of emphysema. So it's usually a long-term exposure to airborne irritants.
Okay.
So smoking is the #1 reason most people have emphysema. So try your best to stop smoking. I know it's hard, but really important. So meditation can be good for that, because it helps reduce some anxiety.
Oh, I definitely have that. Yeah.
Air pollution, like I said, bad exhaust fumes. Don't inhale exhaust fumes, not good for you.
Okay.
Or chemical fumes for that matter.
Oh, all right.
Some signs and symptoms are shortness of breath,
Okay.
wheezing. You might have chronic coughs. You might be coughing a little bit more than you used to.
Okay.
So, orthopnea, which is just when you have shortness of breath while laying down, so like lying on your back.
Gotcha.
So like sleeping and stuff like that. Some treatment options that you have open to you.
Yeah.
Or you can medication.
Yep.
Medication if you want to manage it. Surgery, such as like a lung transplant or something. Lifestyle modifications.
Yep.
So stop smoking, eating healthy, exercising, and some pulmonary rehab. So they'll teach you some breathing techniques.
Oh, gotcha. Yeah.
Do some endurance and strength training.
Right.
And aerobic clearance exercises. Okay.
Alrighty.
Okay, Jake. Get to the side. All right. So the first treatment we're gonna do is called diaphragmatic breathing.
Okay.
And what this is all about is trying to relearn how to use the diaphragm more than the upper chest muscles or the accessory muscles up here.
Gotcha.
This is really good with patients with emphysema, because with emphysema, diaphragm starts to flatten out and stops working as well. So we're gonna strengthen it, get it back in shape, so you can be breathing again.
All right.
Or breathing, you know. So some reasons why you do this is it decreases or it increases subjective dyspnea.
Okay.
Decreases subjective dyspnea, and also decreases respiratory rate, which is a good thing.
Oh, okay.
So what we're gonna do, I'm gonna have one hand on your upper chest,
Yep.
and one hand on your stomach or diaphragm,
Okay.
abdominal area,
Yep.
right underneath the rib, and I'm gonna just have you take a couple breaths.
All right.
In through your nose, out through your mouth. Nice. Now what I want you to do is try to push up on this hand with your stomach, okay? While decreasing the amount my hand goes up on your chest, okay?
Okay.
Now, yep, predominantly try to use there we go. Very good. Okay, now I want you just to raise this hand, the hand on your chest. There we go. Just on the chest. Nice. Now go back to this here. Nice. Great expansion. Nice. So this is a great exercise to do at home too. I'm gonna try putting a weight on it.
Okay.
Sometimes that helps people realize, get awareness of the diaphragm a little bit more,
Okay.
and it's a good way to strengthen the diaphragm because again, it is a muscle. Okay?
Gotcha.
So I'm just gonna put a weight. If you do not have weights at home, what you can do is get creative. You could put a textbook on it. You could
Oh, okay.
anything with any substantial weight. Okay. I'm just gonna put this right where I put my hand. Okay.
Okay.
Just this, that, boom. Now all I want you to do is raise this to the ceiling while trying to keep your chest muscles down. Okay. Yep. There we go. That was a good one. Perfect. Okay. So this is a good exercise to do at home. Okay.
Okay.
One hand on the chest, one on this, and it'll just help you learn to use your diaphragm, which is your primary breathing muscle,
Okay.
more and more, and
Yeah.
less of your upper chest. Okay.
Okay.
Boom. Okay, Jake. So the last thing we're gonna do is some thoracic mobility exercises, pursed lip breathing. Okay.
Okay.
And now what this is? So let's go over pursed lip breathing first.
Yep.
Pursed lip breathing is when you breathe in slowly through your nose
Okay.
and then out through your mouth. So you breathe in for 2 seconds through your nose and out through your mouth. So your inhalation or your expiration is twice as long as your inhalation. Okay.
Okay.
We're going to combine this with some thoracic mobility exercises. And thoracic mobility helps increase the expansion of the chest wall, keeping your upper chest mobile. Okay. And this is also good to relieve some anxiety, calm yourself down. It decreases dyspnea or it increases your tolerance to activity.
Oh, okay.
Without shortness. Okay.
Definitely.
So the first one we're going to do, we're going to sit in the chair,
Okay.
hands behind the back, or hands behind the head,
Okay.
like this.
Yep.
And what you're going to do is you're going to inhale for 2 seconds.
Yep.
While extending up as tall as you can. And then you're going to exhale through your mouth 4 seconds while flexing or bending forward and bringing your elbows together.
Okay.
So it should look a little like this.
Oh, okay.
Okay?
Gotcha.
Let's see you do it. Nice and tall. Yep. Now, but make sure when you're doing pursed lip breathing, if you're not blowing out really, really fast, you're
Okay.
kind of controlling it. So you're like, you purse your lips together like you're whistling. So
Oh, okay.
nice, nice.
Okay.
Okay. Nice. And just make sure you're trying to bring your elbows together too.
Okay.
Okay, perfect. Now, the next one we're gonna do, well, sitting in the chair, right?
Yep.
Or standing, you can do this one standing too. You're gonna keep your hands in front of you,
Okay.
and you're gonna bring your hands up with the inhalation, and then you're gonna exhale once you get to like halfway.
Okay.
Exhale, and bring your arms as back as far as you can, and then slowly dropping the hands to your back.
Oh, okay.
And then to bring your hands back, you just do another breathing cycle. So, in, out. Okay?
So it's
Exhale. So, you exhale once you get to like halfway, okay?
Oh, okay.
So you go,
So
inhale, exhale, bend your elbows, yep, touch your back,
okay.
and then breathe in, exhale. Nice, okay? Yep, remember to keep your lips pursed.
Okay.
Now these are good, so if you have shortness of breath, you can perform the pursed lip breathing by itself, and it'll help
Okay.
you bring you back to a normal respiratory rate or a normal breathing rate for you. Or if you're ever having any difficulty breathing, do some of these.
Yep.
It'll mobilize the chest area,
Okay.
allowing for greater expansion. Okay.
Okay.
Okay, Jake.
Yep.
So Last thing we're gonna do, I'm just gonna tell you some good reasons why you should quit smoking to really drive that boy home to stop, okay?
Alright.
I'm sorry, it's important. So, for example, just after 20 minutes after you stop smoking, your heart rate drops, okay, to a normal level, to your normal level. 12 hours after quitting, I added this all into your little packet too.
Alright.
Your carbon monoxide levels drop,
Okay.
okay, returning to normal.